The hygiene report needs little explanation, but we'll give it to you. What we track with our hygienist is their gross pay, their actual production, their goal, so our production goal in our office, it is 3 times their salary. The variance, so the difference between their goal and what they actually achieved, the patients seen, patients booked by provider, our goal of patients booked in our office at 75%, the variance or the difference between the amount of patients booked by our administration staff or our receptionists, treatment coordinators, and the total amount of patients booked for that hygienist in any given period. So January are the numbers that we're looking at here. To make this report come to life, we'll show you the difference in the report from before the report was introduced to when the report was introduced. We introduced this report to our staff April 2010. If you can see by these numbers here, there's a steady increase in production from our staff members from the minute the report was introduced to them. The report was introduced to them at one meeting, told how to read the report, and they now have access to it. These changes they're making on their own. In a month, this report has paid for the automated manager. If you see Hygienist Betty, and remember that these are real numbers, real data, real statistics, the only thing changed is the name to protect the innocent. If you recognize Hygiene Betty went from a minus 1,700 to a plus 553. This year, Hygienist Betty is set to go, she is at currently $685 above her goal. We predict at this rate she's going to be about $2,000 to $3,000 above her goal by the end of the year. But let's take a look at Hygienist Betty last year. Remember, this report was not introduced to the staff, so in April, where she was this year was up by $600, $500, she was down by $3,000. The end of the year, Hygienist Betty was down $32,195.32. By introducing this report, allowing the staff to have their own access to it, this year she's going to be up by some $2,000 to $3,000, a difference of $34,000 in production. Let's take a look again at her gross pay. Hygienist Betty, for the month of January, gross pay was $6,200. Her production was $1,500. In July, her gross pay was $5,562. Her production was $1,800. A difference of $3,000 with no meetings, just simply introducing her to the report, allowing her access, and letting her own numbers. And we see this statistic repeat itself over and over again. Hygienist Martha wasn't doing bad. However, look at the turnaround. Plus $1,496.73. Let's find out what she did in 2009. 2009, she was down $10,000. We predict in 2010, if her current trend continues, she should be up by a good $3,000, $4,000. An improvement in production of $14,000 by simply allowing her access to the programs, letting her be able to see what's happening, letting her be able to pull up her own information. This is just 2 hygienists. Imagine your savings if you're in office with 3 or 4, or the size of our office with 10. The hygienist being allowed to track and to own their own statistics pays for the automated manager in 1 month.